Rahim. Assalamu alaikum. Welcome, everybody. This is Muslim Healers and Frontliners. We're coming today. This is a show of the Center for Global Muslim Life, and we're going to talk to different Muslim healers and frontliners who are, engaged in this fight against this pandemic around the world, and also those who are engaged in fights, for our hearts in the midst of this difficult moment we're in. I wanted to invite my brother Mark Favors, who I've known for the last 20 years, way back in the day from the University of Colorado at Boulder, and our time at the Boulder MSA when I converted to Islam. It's really a blessing to have you, Mark. How's everything in Harlem? How's everything in New York?
Things seem like it's slowing down, but it's been rough. We've had a lot of deaths, a lot of people got sick from COVID. So, and now people are chomping at the bit to reopen. So, inshallah, we'll see. But it's been very, emotionally draining and difficult, because it was very, devastating on our community.
I can't imagine, but you said you think things are starting to slow down in New York. Can you talk about your journey over the last 2 months, when it started, and then kind of where you're at now?
So, I'm a registered nurse. I work at Harlem Hospital, which is one of the 11 public New York City hospitals. I had a background from ICU, from working at Boulder Community Hospital, but this time I was working in endoscopy GI. So when the governor ordered hospitals to increase all their capacity and critical care capacity, they basically changed our outpatient ambulatory surgery unit into a open air COVID ICU, in which patients aren't separated by rooms. They're just separated by curtains, and all the patients are in one big room. And since I had an ICU background, I was redeployed and I opened that unit, and I've been working in that unit since then. And, it's a unit, since it's open COVID, you have to wear PPE the whole 11.5 hours of the shift. Initially, I worked even some 24-hour shift, but things have been better as, FEMA sending a lot of nurses from out of state.
FEMA sending nurses now, so you have more help, basically.
Yeah, they sent in a lot of nurses from around the country.
And then in terms of a decline, is it 50% less than what it was a few weeks ago, or is it a major decline, or is it slower than that?
When you're in the ICU, it's hard to sit. You really can't see well, because we still have a significant number of patients. We don't have the deaths that we were having earlier, but we're still 80%, in my unit, 80% capacity. So, but it's not the quick turnaround like it was, going initially when, the numbers were very high for the state. So working in ICU, it's hard to just tell what's going on in the broader community.
Does that mean that y'all have figured out some ways in terms of how to deal with patients, or people aren't coming in as sick as they were previously?
For our hospital, I think it's a little bit of both. So I think that the nursing care, the problem, a lot of nurses obviously have reservations with an open ICU, because, you have to wear PPE 12 hours a day straight. It's not like that you can step out of the patient's room and then you're okay. And when we first started, we were only given N95 masks once a week. So, it was very difficult. But I think the advantage we saw is that not having any physical barriers between us and the patients, nurses were able to, I think, deliver a higher level of nursing care. And so I think that may have had some benefits on patients. And, we've used a lot of experimental medications like everybody else has done. So our success rate has been highest among the 11 New York City hospital, of the New York City hospitals. But, it's just hard to tell when you're in the middle of it what's really working. But, nothing is really working like successfully as a silver bullet. You're just seeing some small type benefits.
And can you, I think we were talking a bit before this. Can you talk about what this disease looks like in person? And I think that's the issue, is that you're saying a lot of people would be more scared if they saw what the thing is actually doing.
I mean, it's like you'll have patients come in, they're in the hospital, they're texting, talking to their family. Then suddenly you have to put them on a ventilator because they can't breathe, and then soon after that they've passed away and died. And it's like, and there's just really no rhyme or reason. There's no heads up. There's no prediction. And we've had patients like die as young as 37, 38 years old. It's not just like elderly people. It's all different ages. And then, no families are allowed to see these patients. And so it's just very difficult. However, in my unit, we do allow families to come in, like if it's, at the very end and things don't seem like they're going to change, or we do allow FaceTiming as well.
I mean, the difficulty seems that there's so much different information floating around because people just don't really know fully what the disease is, right? It started with this idea that it was in the lungs. Now they're saying it's impacting the heart, the level of impact it has across the whole body. So have you ever seen anything like this in your career?
No, we've never seen it. And it's like, we'll have some patients where it comes as a cardiac issue. Some patients, it's just a GI issue. They'll just have diarrhea, stomach, and then, some it's like more like an inflammatory issue, like lupus or, something like that. So, and we've seen different, blood levels that we've never seen before. So it's all been new. And I've never seen anything like it, working in trauma, neuro, nothing. And it attacks a lot of patients differently. And then one of my colleagues' mother got COVID, and it seemed to attack her more or her mental status than anything. So it's just very different with different people.
Yeah, I know it's been rough. I mean, I had my family's grandmother, my cousin's grandmother passed away. My uncle, he's has MS, and he can't move he can only move one part of his body because the way that the disease has impacted him. So I mean, it's hard for all of us, right? And that's in Colorado. Your journey? Oh yeah, I wanted to talk about Ramadan. How's this Ramadan for you? I know it's got to be difficult wearing PPE 12 hours a day.
It's difficult, yeah, from that aspect. But then, ever since I started, it's been an issue of faith because, when you go and you're in a COVID unit and you have to wear that PPE, you put trust in, ironically, 3M. I have to wear a 3M respirator. Yeah. So I'm putting trust in these, corporation, that it was always like a journey of faith for me. And, so I tell people, like, my life is real simple right now. You go work in that unit, the next day you wake up, you don't have COVID symptoms, and it's like, alhamdulillah, I'm good. So it's a different journey. Matter of fact, and then I would get nervous because one of my coworkers, who's a young, like 30 years old, he runs marathons, he got like deathly ill, extremely sick. Yeah. And I haven't probably ran a block in like 10 years. And so, but alhamdulillah, I haven't been sick yet, and my antibodies came up negative.
Allah keep you healthy, inshallah, and protect you all.
Yeah. Real quick, so, working in the city hospital, it was like, we have a lot of doctors, a lot of Muslims from all around. So I was like, what happened, one of our residents, what happened to the one resident? And they were like, oh, he went to nights because Ramadan starting. And I was just joking. I was like, man, stuff Allah, you went to nights so you could eat all night and sleep during the day. It's just things like that that kind of, makes you think about Ramadan and laugh. So it was, or we try and tell people to hydrate. Other brothers be like, "Oh no, I'm fasting." So it's been good because we've been blessed and we're healthy and we're still able to take care of people in our community who are sick. So
Oh man, it's got to be an honor to be able to do that. I think some of us, who are at home, it's like we feel like, what can we do? I know there's been a lot of these mutual aid programs that have been going on that people have been putting together to feed people and things. But we think and we pray a lot for you all who are on the front lines, because you all we're sitting here at home and you all are experiencing probably more intense reality than you ever experienced, and especially during the month of Ramadan. So inshallah, you all are rewarded immensely for the work that you're doing. Was your faith part of your journey in being a nurse and thinking about doing this work from the beginning?
well, I was raised more like from my grandmother. Before I really started studying Islam, and I became a nurse straight out of high school when I went in the army, and I just complemented each other because I wanted to be somebody that helped other people. And, so Islam was like the next level from my nursing and doing that. So they've worked hand in hand together, they've worked very well. And so I see them as not separate issues, but just, part of the same, issue. That's just, Allah's way of using me to help the community.
Yeah, that's beautiful. And then you've also, obviously, I've known you from our activism days and from a lot of different work, but you've continued that activism work throughout your life. Can you talk about some of the work you've been doing around how your family's been impacted by the DoD and the work that you've been doing with Mark Ruffalo in this film,
Yeah.
Dark Waters?
Right. So the work I've been doing before this happened was all of a sudden I went to go visit my mom in Colorado Springs 2 years ago, and CBS News showed this story of how basically Peterson Air Force Base, where she worked 40 years, they admitted that they had dumped these toxic PFAS chemicals into the drinking water source for 30 years and didn't tell anybody till they were caught in 2016. This process started in 2017, and since 1970, it was like they would dump it on the ground. It was passive, and then in 1991, they would just dump it directly into the drinking water source. And a lot of my family members had cancer, kidney cancer, with U.S. courts had tied to this chemical. And none of my family members outside of the contamination area got kidney cancer. And then half of these relatives with kidney cancer on my mother's side, half were on my father's side. So it was genetics couldn't explain it. And I had a 14-year-old cousin who had the kidney transplant a couple of years ago, and his mother lived in the contamination area since she was 10. So I've been trying to get, since the Air Force admitted that they did it, I've been trying to hold them responsible, because of Colorado's strict 2-year statute of limitations. Although they admit the contamination lasted for decades, if you didn't die within the last 2 years, there's no legal recourse. So the only justice for my grandparents will be through Congress, because there's no way to sue or anything like that.
And so you testified before Congress, and tell me, how did that go? Were people receptive, or?
It was yeah, people were receptive, and it was interesting because being born and raised in Colorado Springs, I was telling my family story. Colorado Springs, from the Republicans' perspective, we know it's the evangelical Christian capital of the world. A lot of my cousins are, Christians and stuff. So given that perspective, they really, were receptive to Republicans, and they would listen to me and thank me for my service. Their big thing was they wanted to bash Ruffalo, the Hollywood actor. So it was kind of, at first it was a little mostly strange, because it became more of like this political thing. They have passed some bills, but the problem is that I've seen is that no matter if you're Republican or Democrat, it's just very hard for anybody to want to hold the Pentagon accountable, because they're just such a powerful force. It's such a powerful economic engine. One example I give people is that if you see the movie Dark Waters, where it's in Parkersburg, West Virginia, and DuPont, dumped the chemicals, and people were upset that they were suing DuPont because DuPont maybe employed 3,400 people at that time in that town. So it was like DuPont High School, DuPont Avenue. At that time, worldwide, DuPont had maybe 98,000 employees. Right now, just in Colorado Springs alone, the DOD employs 100,000 people.
Wow.
So you can imagine, like, even for Governor Polis, I mean, it's just very hard for people to want to take on somebody. The EPA has a budget of $1 billion per year. The DOD has a budget of $760 billion per year. So we're trying to get all of the veterans together so that we know it doesn't get politicized like it's anti-military per se, but they just, hold accountable. Because a lot of my cousins, while they fought in Iraq, their children were being poisoned in Colorado Springs.
That's crazy. I mean, so if you think about it if the DOD was a corporation, and we know the level of corporate lobbies, how much control they have over Congress, the DOD would be by far the largest corporation in the world. It's realistically, it's the largest entity, a governmental entity, corporate entity, any type of entity on the planet. And with all of its lobbies, right, protecting itself from any type of lawsuits around the world, wrongful death, whatever it may be.
Yeah, I mean, that's the thing. And every state, because they've done this. So in Congress, they've testified that over 400 bases in the U.S. military bases have this contamination, and probably over 150, they've contaminated the local civilian communities. And in every state, Michigan, Colorado, they've claimed sovereign legal immunity. And so, yeah, so it's very difficult. And at first, a lot of the activists with the same issue, but from corporate, the same toxic, but corporate polluters, we would tell them that, like, at least they get to sue. With the DOD, like, you don't get to sue the DOD.
So that's 400 in the U.S. or 400 globally?
So it's pretty much out of 400, probably 380 are in the U.S.
Okay.
So there's a few in Guam. There's a few, Germany, Korea. But like, say, in Okinawa, the DOD won't even let the local community on the base. So they've done blood levels everywhere in the surrounding community. They know it's there. So that's a big problem overseas, and that's a big problem even in Colorado. There's never been an independent investigation of the DOD by the state or by the EPA. They're allowed to police their own. They'll be like, okay, we'll investigate and we'll let you know what we find.
So yeah, it's an uphill battle, but it's one definitely worth fighting. So I
almost quit doing it.
Really?
Stuff a lot. I quit, but then I was like, I just can't allow these people that admitted they poisoned my grandmother and get away with it. And we were talking about Ryan earlier. So my grandmother's parents, they lived in Colorado Springs since the 30s, near where Ryan grew up. My one grandmother's only sister, who didn't move out to the contamination with her, she's 98 years old, lives alone. My grandmother moved to this area, didn't know she was being poisoned. She died 10 years of cancer after she moved out there. Yet her only sister that didn't move to the contamination area is still alive at 98 years old and lives alone.
Wow. So, yeah, our old friend Ryan O'Malley, also we know from back in the day at the University of Colorado, another CU Boulder MSA friend. So yeah, and I think one of the amazing things about shout out to Mark Ruffalo and to Participant Media, right? Because I think that's one of the beautiful things where you have these actors who will take these big budget Hollywood films like these Marvel films and whatever, then to support their activism and to support these films like Dark Waters that would otherwise not have been made and may not have been able to bring as much attention to the issue without some of that work. How has that been, how's the film helped draw more attention to these things?
Oh yeah, it's drawn a lot more attention because, people criticize, like, when when we went to Congress with Ruffalo, because like, oh, you guys are just trying, to sell a movie and a film. But the reality is that we wouldn't have got access to a lot of the elected officials, you know, that we ended up getting access to without the movie and without his help. And that's just the reality of it. My own senator, U.S. Gillibrand, I had been trying to get a meeting with her for days. And then I remember, at the press conference, we were talking about what were everybody doing for the rest of the day. When Ruffalo told me he had a meeting with Gillibrand, I was like, how did you get that? I've been trying to get a meeting with her for like a year. But so you have to. So I think that was beneficial, and it's also the awareness and letting people know that it's out there and it's real. And it's just one of the first of many stories that we'll tell. Because now we have to show the devastating effects this has had on people of color as well, which is a story that hasn't yet been told.
Talk about that a little bit more. I mean, how disproportionate are these realities?
Well, I mean, the one thing is kind of like ironic that, okay, these are near military bases. So a lot of the communities are, mostly white, conservative, military communities like Colorado Springs, smaller Black populations. But when you add up all these different communities, it's a lot of people of color. And then you take some communities like Newburgh, New York, that's a community that's 80% Black and Latino that also was poisoned by, the Air Force using the firefighting foam in their drinking water, and their blood levels have been, some of the highest in the country, like in Colorado Springs as well. And so, so it's devastating. And now, like we talk about with a vaccine for COVID, research has shown that these chemicals, especially in babies and children, they decrease the effectiveness of vaccines. And they decrease the effectiveness of our immune systems. So now, community of color are being already hit hard by this virus, and they've been having these chemicals in their blood that decreases their immune system. So, we have to really kind of address that and make sure that, that our stories get, heard as well. One thing about these chemicals, like I hated to do it, like activists say you should do it. Like I would say, like do a comparison with Flint, where for an adult, lead will be out of your system in like maybe for an adult, like 30 days. PFAS stays in your bloodstream for 8 to 16 years.
Wow.
The half-life, like 8 years. So
that's crazy. So I mean, this is really the intersection of capitalism, environmental degradation, and military power, and all of these things coming together to create this, and racism, right? To create this insane situation that is just getting worse and worse with these gross inequalities that are coming out of this crisis right now.
Right, and I think some people, like a lot of airports use it. A lot of people believe that it was just safer and better. You know what I mean? Because nobody knew it was toxic, but 3M, who ended up selling for the contamination they did in the state of Minnesota last year for $850 million, and the DOD, because they did all these private research studies that they didn't say to the public. So a lot of people, were using, I believe a lot of military people that at the lower levels and a lot of firemen, they really believed that the foam was safer. So it was that because a lot of firemen have had cancer and high cancer rates because, PFAS is like used for Teflon and used to make most things that are waterproof. So a lot of people just really felt like it was safer. And, it's one of those things where, okay, it's safe, you dump it into the ground, but then next thing you know, 30 years later, it's in your drinking water system.
Yeah, that's crazy. I mean, thank you for all your work around this. I think it's really important. So then in closing, right, I think so what are you thinking right now then? What can we do? I mean, one of the things that's been wild to me is to see all these conspiracy theories on the internet about COVID, but yet it seems if there's no medical solution at this point, and I think that's the reason why there's so many conspiracy theories, is because there's so much information that people are really confused. But if there's no medical solution, it has to be policy solutions, and it has to be policy solutions that take the most vulnerable into account. And those are things like, rent holds and real money in people's pockets. So what are you thinking about it as someone on the front line? Like what's the next, 6 months to a year to 2 years look like from a medical perspective, and what do you think should be done at a policy level?
I think just exactly what you said, because even yesterday at work, I'm not gonna lie, the conspiracy theories do drive me crazy a little bit, because when you work, because not everybody in the hospital works in a COVID ICU. You'll come out for a break or something, everybody's talking all these different conspiracy theories, and you're like, and it's like, no, we need to stay focused, even among coworkers. So one thing I think is, and like I've told a lot of my coworkers that got sick, and a lot of them come back and they have guilt that they weren't there when things were bad. What I tell them is, it's a blessing, because we'll need treatment for PTSD for who only God knows how long, for what we saw in that peak time. So I think if you're at home, take that as a blessing, and you've been able to avoid that. So use that time to be proactive, to organize, and to push the policy thing. Because I have one young guy I mentor. He's young guy, went to Stanford, law degree, MBA, and every day he would drive me crazy, because he would want this quick fix. Oh, they say this is going to be a cure, and I just don't see that quick fix happening. So I think what we need to do now is focus on what you said, how people are going to pay their rent, how people are going to be able to stay in their homes, because what if they don't come up with an effective vaccine? Even if they do come up with an effective vaccine, it won't be ready to use for another year. And another thing, one thing that's been the hardest for me is, say, my godchildren and children. They've been just taken out of school. So what's going to happen with them, especially if they don't have parents that don't have to work and can sit home and help them with their homework? Because it doesn't look like they're going to be able to go back to classrooms. And my goddaughters, who's 5 years old, they don't socially distance. So I think we need to look at these educational, how people can stay in their homes, be safe, provide for their families, and then how can we build other infrastructures policy-wise, like schools, and how we can deal with this for the future, and how we can also prevent it from happening again, especially a second wave. Because I tell people at work, I said, so thankfully Allah has got me through this peak. Does he grant me the same favor if there's a second peak? I don't know, but it's a lot going on. But I just think people, like you said, that's the key thing, focus on the policies and start moving things ahead, so, we can prevent this and help protect people, because there's no cure. There's no effective treatment. At our hospital, we're doing all the experimentals, the antibodies, the remdesivir, we're doing all of that, and so there's no vaccine. So we just have to protect our people. And since people of color are dying at such higher rates, this can have devastating effects for, decades.
So you're saying, realistically, even if there was a vaccine, that would be into 2022 almost, before it was even available, realistically. Say it takes another 6 months and then it's a year. That's into almost 2022. So,
probably, I would think maybe a year, a little bit over a year from now at the earliest. And because people, when they say, oh, they're doing all these studies on vaccine right now, all they're testing is that it doesn't kill people. These aren't trials to see if it's effective. All these tests are like, okay, is it safe? How safe is it? So once they get through these, then they still have to do trials to see if it's even effective. And that's going to be, and if they don't pass that, I think, so like HIV, people have been working on HIV for years and they haven't found a vaccine. People say, well, this, virus is different and they should be able to, but, we already know there's several mutations. So we don't know. So I think we just have to focus on what we can do, what we have the power to do that's in front of us, and not get too much ahead, letting our, minds wander on things that are like beyond our control or beyond our ability to verify factually.
And not only that, people have to understand that the conspiracy theories, these things are driven by the same entities that drove the Trump election, right? Whether it's these Russian bots or misinformation, they have these whole misinformation campaigns set up. And part of the reason for that is to make it look like, to not focus on how ineffective of a response the federal government has had to this, and so
Right.
And so
But one thing that's funny too, talking to people in New York City, talk to a couple of, is you and I know we were raised around these same people. We grew up around people that believe a doomsday was coming, so we're familiar with this and we know this. But a lot of people, they don't understand that sophistication. That's why I decided to wear for this shirt the Black Panther Party, who were the first ones that really started this whole, rallies with arms, and ever, which now has been like somehow co-opted to be something about, which isn't true with this, with this COVID. So I think, that we have to, exactly what you said, understand who's the source of all these things. And the bottom line is, I tell these people all the time, if you believe it's a hoax, come to my job, Harlem Hospital, 512 Lenox Boulevard, which has been changed to Malcolm X Boulevard, and you can shadow me in my COVID unit without your N95. If you really believe it's a hoax,
well,
you can come do that. But otherwise, don't put that information out to people that are just, that misinformation, that are just getting people distracted, and it's dangerous.
And especially these faith leaders. I've seen Muslim leaders, some faith leaders put this stuff out. It's just irresponsible, in my opinion, like distracting, and could literally get people killed.
Yeah, that's, I told, my cousins, they did a whole family Zoom for Mother's Day. My cousins, they're very big into, Pentecostal church. And I was telling her that, like, all the people, you see around here, people say, oh, it's faith. I said, all the people who we saw die, all those people had families that prayed over them, that were very strong people of faith. And there was the story in one of the Pentecostal Black churches, I think like 20, 30 bishops died because they all had these meetings and a lot of them got sick. So now they're recognizing at such a terrible cost that this isn't about fake, this is real. And so I think that's what we have to tell people, is that, this is real. It's serious. It's not a test of faith. It is, but as far as like, not that you just go out there and just allow other people, to be harmed. It's like, I remember one time I found this book and they talked about how the Muslims were the first ones back in the day, before they would build a hospital, they would put sticks up and put pieces of meat, and whichever places the meat rotted the slowest, that's where they would build a hospital. So especially in the Muslim community, we've been acknowledging science-based medicine and infectious disease before the rest of the world even thought about it. So there's really no need for us to be ignoring it at this time. This is the time where we need to be on the forefront of this pandemic, as far as solution-wise and policy-wise.
And a lot of the masajid have come through in terms of having these public programs and things where the community, like having iftars and serving the community that are in need. So that's been a blessing, and we can't, we forget that. So yeah, I just wanted to thank you again for your time. May Allah bless.
Yeah, they've been doing great. All the, the masjids having, a lot of the doctors I work with, Muslim doctors, and everybody's been stepping up, but it's just those smaller numbers. I think everybody now looks at this as, I think nobody seriously thinks that this virus is particular, because no matter, the outcomes have been the same no matter what race, religion, or creed the person has. It's not like COVID. Like, we used to tell this with PFAS. PFAS, that's what hurt a lot of white Americans, because PFAS didn't recognize race. PFAS, it doesn't stop just because your community is affluent. It's the same way here. COVID doesn't recognize your politics, your race, your religion, or your creed. So, that's just the facts, and we have to work around that.
No,
And thanks for your prayers.
yeah.
That's what I feel. That's why I haven't been sick when a lot of my coworkers around me got COVID and got very sick.
No, and that's the reality. Is it's a journey as people of faith, but we have to. I believe we have to also reflect on what this all means. What is, Allah is the controller of the universe and all that's in it. What does this whole thing mean? Like for us as a people globally, that this level of a disease has impacted the whole world. What does it mean that we have to change and transform? What type of world can we create, right?
Oh yeah, I mean, yeah, it's like now. You remember that whole thing? There was such a big debate on universal Medicare, and now look at all the money we've had to spend now just for this, and then also like all the essential workers. Like you don't want nowadays. You don't want you don't want those people need sick leave right now. We don't. We're society's totally dependent on like the essential workers as far as the delivery people, the people in the stores. Because for us as medical, this is what we signed up for. But I think when you look at the people like the delivery people, the grocery stores, those are the people that are really making a big, sacrifice because they didn't sign up, to have to risk themselves in a pandemic like this. And now, I was talking to some of the activists in Detroit with the water cutoff. It's like, why would you not want an essential worker who's putting the fruit out in your grocery store, delivering you food? You don't want them to have running water? I mean, how crazy is that, right?
I mean, I remember right when this started, like the first week it started, I was at Costco, and the lady checking the tickets when you leave, someone was being really rude to her, and I went up to her and she's just like, they just don't understand what this is like. She was in such a state of shock and literally like, I think I'm going to go home, right? Because she's so scared. And you're right. Like you have a $16 an hour job, maybe if you're lucky, if you're working at Costco and you put in your whole life at risk for people to buy food. I mean, yeah, it's really difficult. You're right. I mean, and then no solutions, no pay increases, no anything. So yeah, we have to come up with real solutions. And unfortunately, our government is so ineffective that it just seems like the only thing that's moving is corporate money.
Yeah, we have to battle that, and we have a lot of time. People use this time to organize wisely. Like I said, I was talking to the activists in Michigan, Detroit, with the water cutoffs. I mean, to me, it was like it just made no sense that you would want an essential worker to not have running water, because the sanitizer is limited to what they can do in their own homes. It makes no sense to me, and so we have to fight these battles because healthcare. This is what we signed up for. We're organized. We could take care of ourselves, but I think for you all, the Muslim community, try and help out those people that aren't organized, don't have the unions behind them. Those are the people that we need to be concerned about and looked after. How do they pay their rent? How do they like one issue we're struggling with with my godchildren is like the babysitting, childcare. You have to go to work. You have to figure out and talk about iman or faith. Like, who do you let watch your children? You know what I mean? It's like that's one struggle with my god kids. It's like all of a sudden, one babysitter, they're not coming. So then you have to figure out how you're going to provide childcare while you have to go to work. And I don't think people are really looking at that right now. And so those are other things we have to look at.
And be prepared for what comes next, because like here they put a statewide stay on evictions until May 31st. And in San Diego County, the sheriff started trying to move on it on like May 11th. He had like something like 70 evictions they were going to do that day. Before that was even allowed at the state level, the sheriff decided to go. So activists organized that day, and we're able to stop it. But can you imagine, like, just start kicking, like if they're that hungry to start it, even though there's a statewide stop, that's what's coming, right? And we as people, like, what are you going to do? Kick people out of their homes in the middle of this pandemic, and then then you have whole families that are homeless in the middle of this, and just makes everything worse. I mean,
are they able to go to court? Is there housing court is open in California?
no, it's
How
supposed.
are they evicted?
I think it was evictions that had already been ordered when this,
Oh, okay.
and so then they decided to start trying to serve them, and they were like, no, you can't. Like, it's a statewide order. You can't do that. But
It's crazy because I heard somebody argue, a prison official, that the reason why you shouldn't let prisoners out for COVID is because they can go out and infect other people. So if you put people out on the street, like, you would, from a public health perspective, it's like, why would you want to have these people that will have to go to all these different households trying to live and have activists? I know in New York, they've allowed deposits to be used towards rent. Have they done similar things in California?
to be used for rent?
The deposit. So, deposit that you use to move in New York now, the governor has allowed that can be used towards like a month's rent.
Yeah, they haven't done that in California. Not at that level.
Yeah. So I hope with everybody, activists out here, get on the same page, but we got to stop these evictions. We got to get people provided. We got to stop these water shut offs, and we just have to. This is the time that everybody has to step up, and it doesn't have to be like in COVID. There's many other things, like policy wise, that needs to be done. Because a lot of times as activists, we want to go and jump in the fire, and then we let the policy slide, and then we already know how that works against us. So I think a lot of people now, we need a strong army to focus just on the policy issues.
Yeah, just phone calls and emails. I mean, enough, right? Like, we could really move some things. I mean, even here, part of the big issue is the border, right? And these detention centers, with now some of them, all these people that are infected, and they won't let anybody out. So yeah, I mean, we really have to move on these things because people's lives are at risk. I mean, and I think that's what all of us at home can do. That's what we can do, is try to get people out, try to focus on helping people where we can.
Yeah, and people understand like the connection with, these detention centers. They're not like some of the other American prison complexes where they're self entities. So people go in and out and come back to society. People have to work there. Essential workers have to take food. They have to do all these things. So if you think they're isolated from the community, they're really not, because they're connected with people who come back into the community on a daily basis. So you can't look at them as like separate. We have to look at everybody as part of the community, because if not, that's how it will spread. It's not like that I used to tell people that work, it's not like you could put up your hands and say stop and then COVID just stops. It doesn't work like that. It moves on, from the next thing for wherever it can. It's very opportunistic. So we have to look at everybody in the community as one entity.
Yeah. Amen. I mean, all right, brother. So enjoy the rest of your month of Ramadan, what you get to enjoy of it, and Allah protect you and keep you safe throughout this. And we'll be thinking about you. And again, thank you for taking the time. Much love to your family. Much love to you.
Sorry about the beard, but that was one of my, as we used to study back in Boulder, faith, iman increases and decreases. As I was like, sometimes when I go to shave, because I'm in that unit, I'll be like, man, stuff for Allah. Because they say with the mask, I was like, but a lot of the other Muslim doctors, they haven't. But it's just
I look ridiculous with a mask with this beard. It's like coming out, but I gotta wear it.
Right.
Yeah, brother. All right, man. So yeah, much love to you. Much love to Harlem.
Yeah, thank you very much, and keep us in your prayers, and eventually, we'll get through this. but we got to start thinking globally as a community.
Yeah, that's right. Yeah, and that's what we're trying to do with this center, is say, a lot of the politics of the last 20 years for us as Muslims have been trying to put us into boxes, but none of us, those of us, especially as converts who entered through the door of Malcolm, right? Malcolm was always talking about an internationalist vision of globally connected people and globally connected Muslims. And the Muslims have, we've lost that in becoming so American Muslim. So that's what we're really trying to do, is how do we connect each other globally and in our hearts.
I got to tell you a funny story real quick there's this push because 25% of the GDP of this country was on elective procedures. A lot of hospitals are losing money for elective procedures. So one of my managers, I was like, we can't be doing this rush. We need to, the governor hasn't even given us permission in New York City. We got to slow down and do this. I was like, I don't want an outbreak to happen, just because somebody had to go get the tummy tuck. And, she's African American. She's like, okay, all right, Malcolm X. I said, well, the hospital is on Malcolm X Boulevard. So, so I'm just, representing. So.
Y'all got that beautiful reminder every day.
Exactly.
Yeah. God bless Malcolm X and Betty Shabazz. Yeah, man. All right.
Yeah.
Great to see you, brother.
Yeah, good to see you.
Yeah, keep up the good work, and you as well. All right. Assalamu alaikum.
Alaikum salam.